So Tess, thank you for having us at your house today, and I think we should start off by asking you where you were born.
I was born in Maryborough, Queensland on the 22nd of February 1926. I was the third of four daughters, so we were very much an all-girl family and orientated to being an all-girl family.
So after you completed your medical course in 1951,
Yeah.
you decided you'd go to the Royal Brisbane Hospital?
I had a very happy time at Royal Brisbane. I loved the panorama of medicine that anaesthetics provided, all the specialties we saw, and we saw the pre-operative management of these patients as well as their post-operative care.
So how about your involvement at the Mater?
Well, Lou Davies was the paediatric plastic surgeon. He had an anaesthetist at the Mater who couldn't put down endotracheal tubes, and he was doing these poor little babies with cleft lips and palates with a boiled over scag and blow over ether, and he asked me if I would come to the Mater and give his anaesthetics. So I kept on giving anaesthetics at the Mater Children's till 1974.
So when did you become politically active?
Well, John, it's really quite an interesting story. I didn't intend to go to the meeting of the Australian Society of Anaesthetists one night, and Joan Dunn said to me, "Are you coming to the ASA meeting tonight?" And I said, "Oh no, I can't be bothered going to the ASA meeting." And she said, "You must go." So when the boss said you must go, I went, and I ended up being the State Secretary of the ASA. And so I had political involvement thrust upon me. It was not by choice at that stage.
So you'd stood for election to the faculty in 63 but weren't elected, but had another crack at it in 65?
Yeah.
And got elected to the board?
Yes.
So what were your main things that you achieved when you were dean?
Well, I think rotational training, accreditation of hospitals,
Yes.
and regular inspections of hospitals. And of course, this persists to this day.
So you became local president of the AMA in 82?
You were invited to be president, and I was rung up and asked to be president in 1978. But I'd just been appointed Professor of Anaesthetics, and I wanted to get the anaesthetic department established properly, so I knocked them back and said no, I couldn't be president. And then when I was asked the second time, I thought, if I knock it back again, they'll never ask another woman. So I said yes, I'd be president.
So as well as anaesthesia, you became interested in pain.
I became interested in pain when I was in Dallas, actually, because they had this big congress, and John Monica was coming, and he invited me to visit, and that's where I saw the Multidisciplinary Pain Centre established. So I decided we've got to have a pain clinic.
So you developed your multidisciplinary pain clinic?
Oh yes, we had psychiatry right from the start. John O'Regan was the director of psychiatry, and he was very helpful and saw patients for us. So that was great. We had a multidisciplinary team right from the start.
So the multidisciplinary clinic at the Royal has been named after you, I believe?
Yes, that was on the 30th of April 2008. And the previous Governor of Queensland, Honourable Quentin Bryce, named the unit in my name. So we had this lovely ceremony at Government House.
How did you feel on the day when you had the ceremony at Government House that they named the clinic after you?
I was overawed, really. Some people have great testosterone upon them. I wasn't looking for that. I just wanted a functioning unit that would train people. And I think the nicest thing is that we've got a group of people now that we've trained. See, we've trained something like 35 pain specialists since the first exam in 2000. And that's a big contribution.
So the college has a section on pain now,
They've got a Faculty of Pain Medicine.
and they've got their own diploma in pain management.
Oh yes, and it's quite it's a multidisciplinary diploma. They've got psychiatrists, neurosurgeons, physicians, rehab medicine people.
So Tess, what do you think have been the major improvements in anaesthesia since you started?
The major improvements have been better pre-operative assessment and better monitoring facilities. When you think that we had one ECG for the whole of the theatre complex when I started, and our best way of monitoring the patient was during induction was to have a cooperative surgeon who'd stand there with his finger on the pulse and hold the sucker for you. When I was appointed Professor of Anaesthetics, I bought an oximeter, and it was like a bicycle helmet. It fitted over the patient's ears, and when it broke down, it had to go to Sydney to be repaired, and it cost $6,000. Whereas now you can get a decent pulse oximeter for $500.
It's one of the greatest advances since in your time.
Absolutely, and pulse oximetry has just been marvellous, non-invasive, very simple to apply, and very easy to interpret.
Well, Tess, thank you very much for letting us in on all your family secrets and your teaching secrets. I'm sure it will be of interest to a lot of anaesthetists and a lot of people in general. So thank you once again.
Well, thank you, John, and thank you for giving your time, not only today, but for the preparation for the interview. I've enjoyed reminiscing and remembering the very happy times that anaesthesia has given me.